Hi everyone, I hope you're all safe and well, and where possible, trying to make the most of this COVID lockdown situation. This is an aid memo for all my patients for some gum related maintenance and cleaning while you're unable to see me. So, first of all, I will follow the sequence of cleaning as I recommend for you to do in your mouth. So the first stage, which I always recommend, is a use of an interdental brush, and these come in various different shapes and sizes, and they come from various brands as well. One of the commonly recommended brand is TP brush. This brush comes with a lid, which can either protect the bristles of the interdental brush, or it can either be used as an extender by attaching it to the back of the brush. Now, these come in various different colors. The color coding is for the diameter of the brush. And as I recommended, you may recall from memory, I always recommend to connect the lid to the back of the brush so the brush is more extended, so you have some space to hold the brush really well. And then you can relax your facial muscles, because these muscles, you may remember from memory, are quite tight when we open our mouth really wide. So if we were to open our mouth really wide, this muscle stretches and there is no way we can get to the back of the mouth. On the contrary, if we keep this muscle relaxed, the cheek is like a pouch and it's nice and loose for us to go right to the back of the mouth with one of these brushes. So by loosening the face and keeping really relaxed, loose face, you're able to then go right to the back of the mouth. Okay, so how we do this inside the mouth is we take our brush and we connect the extender to the back of the brush, and then we either keep the brush really straight, or if the teeth are really tight contact, then we make a gentle curve in the brush, and then we gently, with a watch winding movement, take the bristles in between the teeth. Once that is achieved, then we press the bristles gently towards the gum line, so as if the bristle is now under the gum margin. Then we pass the brush 4 to 5 times around the front tooth, and then 4 to 5 times around the back tooth. And the bristles right now are tucking under the gum margins. Then we simply rotate the brush and take it out of the contact and give it a really good rinse, and continue in various different gaps. Now, for different spaces and different gaps, you may require a bigger brush. Always remember to have a snug fitting brush, but it shouldn't be so tight that it hurts your gum or it's really, really painful while passing through. So it should be snug, but it shouldn't be far too tight. Finally, once you have used your TP brush in all areas in your upper jaw, do the same for your bottom jaw. And then for many of my patients, I often recommend a single tufted brush. This brush has just a single wad of bristles, and this is used by holding it in a pen grasp, just like that, just like we would hold a pen for writing, either downwards or upwards. And then we take the bristle to the side of the cheek and press the bristles onto the tooth. And when the bristles are splayed, we just go upwards and downwards. So right now we are tucking the bristles under the gum. Just like this, upwards and downwards. The bristle will, as I said, will go under the gum line as well. So press the bristles, splay the bristles out and tuck under the gum. So you're cleaning effectively upwards and downwards, flushing out any debris from underneath the gum pockets. Finally, once you have done your interproximal brushes, whatever size you needed, and you have done your single wad of bristles or single tufted brush, this is many times I would recommend this for patients with really crowded teeth like my own, down here in the bottom of the jaw. Again, the bristles of the brush are pushed towards the tooth and splayed outwards and then upwards, and flushing as if we are cleaning the gum outwards and upwards, and even in the inside surfaces of the teeth. Once this is done, then for the electric toothbrush, one of my personal favorites is Oral-B, but you could use any electric toothbrush as you wish. One of the key factors while purchasing an electric toothbrush is a small brush head. So as I said, cheek muscle can be really restrictive, and especially when we open wide, this muscle can be really restrictive and the spaces in the back of the mouth can be very small. So a smaller the head, the more effective you can get to the back of the mouth. Also, if the brush is circular, just as our gums are, the gums are scalloped or circular, it makes sense to use this sort of design of the toothbrush. So as I always say, make sure your brush is charged, turn the brush on, and do not travel with an electric brush. And the electric brush has taken out all the extra functionality and it's meant to be easier for us. So we don't need to really travel with it. Once we have activated the brush, all we need to do is go upwards and downwards, and in between the teeth. So the bristle is overlapping the gum a little and giving the gum a gentle massage, and then we are cleaning the teeth as well. And then we move up to the next tooth and the interdental contact point. So we travel upwards and downwards, and we don't go sideways. We don't have the brush on and then travel sideways. We always go upwards and downwards. Once you have done your teeth, if you wish to then clean your tongue, some people either use a tongue scraper or a cheek cleaner, or some patients prefer to use their own toothbrush to clean the surface of the tongue. I hope this video is useful for you and it helps you in keeping your gums under good hygiene during this lockdown. And if you have any doubts, you can email the practice wherever I've seen you, and the practice will email me back, and I'm happy to help. Thank you.